Hello, my friends. I'm Dr. Rodrigo Rodriguez, Medical Director of BioCare Hospital. And today, I hope you're watching us through Truth Be Told Radio Network as every Friday. And don't forget that we repeat the same program every Saturday morning. Now, if you go to Spotify, in other words, you take control of your own time, you go to Spotify and you search for Truth Be Told Radio Network, you can listen to this program at your convenience. You can listen to it on your car, at home, at work, uh, on your porch, having a cup of coffee. You can do it at any time. You just have to search for Truth Be Told Radio Network and look for Dr. Rodrigo Rodriguez and IBC Hospital, International BioCare Hospital. And you're going to find us. Not only you're going to find this program, but you're going to find over 150 programs like this. And we touch in so many subjects because you know what's my calling? My calling is to help you find the way to better health, find the way to stay away from disease, find the way to be healthy and enjoy your life. And that if we ever have to meet each other is because you want to do a rejuvenation program, a restoration program, something like this at BioCare Hospital. And you can do prevention, you can do health management, you can do a lot of things, weight loss, you name it. But things that are going to enhance your health, your lifestyle, your welfare, that's what I'd like you to do. I don't really like to see sick people, even though I have to see many sick people every day. I'm a doctor, I work at BioCare Hospital, and I talk to patients and I see patients and I see a lot of health problems that I wish I would have seen 5, 10 years before because I know the picture would be completely different. And what I want you to do is to be aware that you have a lot of things within your reach, within your hand, that you can modify in order to be healthier and in order to keep your health and your life expectancy as day one. Because unfortunately, many people who have a very good life expectancy, they start losing months, years, and so on. And then all of a sudden we hear that somebody that we thought was very young and looked very healthy just died of a heart attack or just had a stroke or he was just diagnosed with cancer. And all of these diseases we really don't even want to hear about. We hate them. We hate them because we know they are the beginning of a lot of issues, a lot of big problems, a lot of expenditure, a lot of suffering, a lot of pain, a lot of appointments with doctors and laboratories and x-rays and hospital stays and surgical procedures and chemotherapy and aggressive drugs, etc., etc., etc. We know because we all have seen somebody going through this pathway. And what I want to do, and once again, that's my calling, I want you to be healthy and stay away from all these diseases. We just have gone through a period where we can prove that a lot of the things that I'm saying are true. We just have gone through a pandemic that killed a big number of people. And we all probably have lost someone we loved to this disease. And when it all began, we were concerned about this. But all of a sudden, we thought it was getting mean and complicated and expensive. And finally, we saw friends and family members just succumbing to this disease. And I remember, and you don't have to go too far. You can go to some of the programs I did in the past, and you're going to hear me saying that in the Spanish flu this happened, in the Spanish flu that happened. Well, now we went through a second Spanish flu altogether. We had a tremendous disease, And in this case, like in the case of Spanish flu, we had a lot of people that were sick, a lot of people that died, a lot of people that had terrible complications. We had a lot of people too that went through the disease with minor problems. Why some people did have so little problems with the disease? Why many people didn't even get the disease? I talk to people every day, and many times I say, "Did you have COVID 19?" I say, "No, I didn't." And you wonder why. And actually, that question is something that started coming along as soon as the pandemic started. And back in 2020, in Italy, when the pandemic struck very hard and people were dying just one after the other, of course, medical doctors started doing biopsies and autopsies and reviewing the cases and reviewing laboratory results and just wondering what happened on one hand. But on the other hand, what happened or why a big number of people didn't get the disease, or if they got it, it was very mild. And yes, we know that in many cases the disease was very aggressive because some of people were overweight, high blood pressure, heart disease, diabetes was a big one that seemed to complicate things in such a way that people with all these problems were more likely to go to hospital, intensive care unit, and die. Whereas some other people were doing very well or fairly well. But nevertheless, they didn't have to go to a hospital, they didn't have any major problems, and that is because they had something within them that kept them far from the very serious disease or far from the disease altogether. And when they started doing this thing, they found that we are not all equal. Okay? Same as you have shorter people, taller people, stronger people, weaker people, blondes and dark hair, etc. We also have a different body constitution that allows us to be resistant to certain problems, health problems, but also some other ones that will make us easy prey for a lot of diseases. And they started digging and finding out, and one of the first findings was related to a very important nutrient, vitamin D3. They saw that most people that were succumbing to the disease or getting serious effects from the disease had very low vitamin D, D3 levels. Whereas people that had good or even high levels of vitamin D were a lot more resistant. They could resist the disease, and if they got it, they were more resilient. They came back, they bounced back in a much better way because they had vitamin D. Another important nutrient in this same situation was zinc. You know, zinc lozenges for people about my age have been around for years and years, decades. And they were touted as a treatment or as a remedy or as a prevention therapy for flu. Well, it turns out that they were absolutely right. A good level of zinc blocks viral reproduction in your body. So if you only have good zinc amounts in your blood, you're going to be doing very well. And if you get a bug in your throat and you put some zinc in it, you're going to block it. So zinc lozenges made a lot of sense. You take one of those pills, you just let it dissolve in your mouth. Zinc is going to coat your throat, and then the viruses are going to find it very difficult to nest in your own tissue. So, those simple remedies were talking about a very important fact. If we are prepared, if we have a body ready to face the challenge, our chances are going to be a lot better. And that's what we have been talking for months and years and so on. Uh, don't let yourself fall into compliance. Just relax, enjoy, be comfortable, because you might fall prey of the following health problem, or you might even succumb to it, or a disease might be ready to jump at you right this minute. So what we have to do is we have to look at ourselves, review where we are, review how we are fed, review what are our strengths and what are our weaknesses, and start getting ready for whatever the future brings. So testing for vitamin D, making sure that we have a good zinc level, making sure that we take magnesium, which is the most common mineral deficiency in America today. Why? Because the soil has been depleted of magnesium. So even if you're a vegetarian, you're not eating enough magnesium. Which brings me to another very important fact. It's not just what you eat, but where that food is coming from. Because you might have what many people might think, oh, it's a great diet, still be deficient. So you have to go to a doctor, you have to go to a place that understands all this and tells you, I'm going to check this, I'm going to check the other, I'm going to give you simple advice that's going to turn your life around. Once again, not only what I eat, but where that food is coming from, how that food was created. And that is going to give me the extra push to be healthy. And then supplement, because I know magnesium is not in the food I have to supplement magnesium. Zinc, I don't get it the amounts I need. I'm going to supplement that, and I'm going to supplement vitamin D because number one, I might not be under conditions to create it. Number two, if I'm getting older, my capacity to produce vitamin D is going to be down. So I have to supplement it. And who can give you that advice? BioCare. Don't go anywhere. I'm going to keep talking with you, and this is important information. My friends, here I am. I'm Dr. Rodrigo Rodriguez, Medical Director of BioCare Hospital. And I'm back with you. And I'm making a number of propositions that I do not necessarily want you to take for granted. I consider you might have questions, you might have comments about them. So please just follow me. You can go to the social media of your choice and you're going to find me there, BioCare Hospital or Dr. Rodriguez. And you can ask your questions. Because if you ask a question, you're going to get an answer. If you don't ask anything, if you just have a doubt and keep it, you're going to go nowhere. But what about starting a conversation? That's why I love when people join on social media, because that creates a team. And that team creates an army of people willing to defeat disease. And we can. You can go to your workplace, to your church, talk to everybody and say, why don't we make a team, a health team? Let's review what problems we have. Let's see what is our weight. Let's see what is our sugar level, our blood pressure. Simple things like that. And let's start a program so by the end of next month, we have average 10, 20 millimeters of blood pressure down. Or 20, 50 pounds between all of us down, or sugar levels that went on an average 10 units down. You see, it is that easy. And it's really good when you get company in all these sort of quests, because for a reason it's easier to do it and it's more rewarding. So you can do it at home with your spouse, you can do it with family members, or you can do it at the workplace or on your neighborhood or your church and say, why don't we start a health program? And you can call me. You can let me know who you are, how many you are, what is the weight. And it's very easy today with computers. You just put all the names or initials if you don't want the names, and just put what is the weight, what is the sugar level, what is the blood pressure. Now we're going to start doing something for it. And at the end of the month, we're going to look at all these figures. And then what happens next month? And I'm going to give you a very simple goal. What about what happened from here to next Christmas? We might have a very Merry Christmas if we all are healthy, if we all are strong, and if we all are doing better. See? And this brings ideas. Because many times you say, I want to do this, and somebody tells you, I know how to do it. Or I have a recipe for this. Or I started doing this thing and it's working for me. So it's very important to share. It's very important to be part of a group that wants to do something. And in talking about what I can do with me and my life, there's something that is completely free. It costs you zero. You're going to spend nothing. Yet is one of the cornerstones stones of good health. It's a big part of all the health you can have is in just these couple of words, and that is physical activity. And the question is physical activity really everything it promises? It's really going to change my life? And if so, why? And the question why is very important, and I want to touch on that, because if we understand why, it's going to be a lot easier to follow it up. If we just say, well, you have to walk 10,000 steps, well, you just have to do this, you have to weight lift, you have to go to the gym, not necessarily tells you why. And people say, are you telling me that if I do exercise, chemotherapy in cancer could work better? Doesn't make sense at first glance, or I don't see the association between cancer therapy and physical activity. But let me tell you, and many of you listening tonight or this morning or wherever you are in the world's time, when listening to this program, those of you that have been around for few decades, what about 50 years? Let's go back 50 years. Let's go back about 1970. And what about if we go back 70 years? If we go back to 1950? Do you know where a lot of the strength and energy and power to do a lot of daily things came from? From my arms, from my back, from my legs. Why? Because we used to do the laundry, we used to do the garden, we used to do the housekeeping, we used to walk to school, When is the last time you saw children uh, leap jumping or just jumping the rope or playing tag? When is the last time you saw children doing that? We used to do it every evening. Every evening after we did homework, we would ask our family to let us go out and play with the kids. But to play with the kids meant a very intense physical activity, like dodgeball or anything like this. Anyway, it meant running and jumping and playing and a lot of laughter. Now there's silence. You go to a house and you find everything silent because children are playing. You say, where are the children playing? In a bunch of pillows? Because I don't hear any noise. No, they're playing with their fingers. They're playing with their gadgets. For them, that's a play. Because manufacturers call this a game. They sell it as a game, and you give it to children to play. How much energy you think you spend when you move your thumbs? Nothing. But exercise is important. And it's important for everybody. And the children are playing with the phones, and we are sitting in a couch watching TV. And we're snacking on bad foods, and then we go for dinner, and from dinner we go to bed. So modern life has brought a lot of so-called comfort. Now, that comfort has come at a cost. We're paying for it. We're paying for it with our health because we don't move. Now, the question is very simple. Doctor, if I don't do a lot of exercise and so forth, but I eat well, blah, 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 everybody claims to eat well. What is the problem? Or the other one that people tell me, but doctor, I walk in my office. I go sometimes downstairs. I do this, I do that. They hardly do anything. Nevertheless, they use it as an excuse. What is the idea behind physical activity, behind exercise? What happens when you move? Well, what happens when you move is two very important things. Two things. Keep those two in mind all the time. One, you generate heat. It's not a mystery that if you go downstairs or upstairs or do anything physical, immediately you start feeling hot because you're creating a lot of heat. Second, you are moving your blood because as you move, the muscles require more oxygen, require more nutrients. So they send a message and they ask the heart to pump faster. So our pulse rate is going to go up and blood is going to start flowing. So we have a hotter body with a lot of blood flowing. Those two things can change your life. They change your life, actually. When you generate heat, as you raise the temperature in the body, we are a chemical system. We're filled with chemical molecules and chemical reactions. And it is an absolute truth, a physical, chemical truth, that as you raise the temperature of a chemical system, the interaction of atoms and molecules and things happens faster. So as you increase the heat of the body, the reactions of every single enzyme, every single function, every single part of your body becomes a lot more active. and your immune system gets better, and your cleaning and cleansing and detoxification gets better, etc. If on top of that you have more blood flowing, then what you're going to be doing is that you're going to be delivering more and more oxygen to every single cell of the body. And you're going to be delivering a lot more nutrients. But at the same time, remember that the blood will bring all these things, but it's going to come back with residues, with toxins, with things you don't need in your body, like lactic acids, carbon dioxide. All these substances are going to be drawn back to the heart, to the lungs, to the kidneys, and they're going to be eliminated of the body. So you're nourishing your body, and at the same time, you're cleansing your body. And with a higher temperature, you are producing a lot of good functions, and you can feel it. All I want you to do right now is go outdoors, run around your block, come back. You're going to wait till you finally catch your breath. Then you catch your breath finally, you start relaxing, and you will remember my words tomorrow morning when you see how beautifully you slept, because you oxygenated your body and you clear a lot of toxins. Don't go anywhere. I want to keep on talking. Dear friends, I'm happy. I'm happy because you're with me, because you're listening, and I really honestly hope that you're learning something you didn't know. And I hope you're thinking of how you can make your life healthier. Because after all, health is what keeps us moving, loving, dreaming, working, producing. And because we love who we are and we love the people we have around. So being healthy is fantastic. Also, remember my words. Health pays. In other words, if you're healthy, you are producing, you are going to be able to support yourself and your family and be a benefit and a blessing to others. So it's very important that we keep healthy. And if you have any questions, if you want to know anything about it, if you want any advice, any guidance, whatever, no matter how simple it might be, just contact me. Follow me. I'm Dr. Rodrigo Rodriguez, and you can find me in Facebook or Instagram, Twitter, you name it. I lost track of how many of those things are today, but I'm in all of them, thanks to my good friends in the technological world that helped me to accomplish all this. I couldn't do it myself, that's for sure. But you can contact me, you can ask your questions, you can ask some guidance, you can comment, or you can even argue about any of the ideas, and we can see what we can find out together and try to clarify a lot of concepts. And today we're talking about of exercise. We're talking about why physical activity can really make a difference. And we're talking about two things. One, that we're paying a very high cost for ignoring these facts. Why? Because by not having physical activity as we used to do it. When I was a kid, I walked to school. We did a lot of things at home. My mother used to do laundry by hand and ironing by hand. And we fixed the garden and mowed the lawn and cleaned the sidewalk. And we were always cleaning and doing things physically. And when you were a kid, you were playing a lot of physical games in terms of physical activity. You play tag and you play leap jumping and these type of things, which I don't see kids doing it anymore. I even wonder sometimes if they know what it is because they play with their gadgets. And that means no physical activity. And remember that one of the keys for good health is calorie balance, caloric balance. In other words, we have to get in about the same amount of energy that we need to live and to function. But what we're doing is we're doing nothing, so our energy expenditure is very low, and we keep on eating as if we were digging ditches all day long. The end result is we're fat, simple as that. We're very fat. And on top of that, we eat a lot of wrong foods. And if you go to Spotify and you search Truth Be Told Radio Network, you're going to find a lot of programs that I have done talking and discussing what is good eating. But we're far from it. We're very far from it. So if we start getting that caloric balance in order, so forth, one of the best ways to help it is through physical activity. There's a very important report published recently by an important physician from Yale University, and this is Dr. Perry Wilson. And he discusses that what we need to do is that we need to use about 150 minutes of physical activity every week. Well, if you do a simple math, you're going to see that that represents about half an hour every day. Monday through Friday, you're going to have a break on the weekend. And that activity is enough to probably offset 30% of mortality in the American population. That's very good. Not only that, but you can also improve your chances of getting heart and vascular disease by 23%. And you can skip cancer by 12% just by being active. So we want to do 150 minutes every week, and we're going to do 30 minutes of physical activity every day, Monday through Friday. How we do that? Well, you can count everything. I actually advise many people, now with the cell phone you can do it. You don't need any extra gadget. All you need to do is get one of those activity meters, and you can check how many steps, how active you were during the day, and you can see how many days how many hours of the day you were active. And at the office, you can go upstairs and downstairs, even if you don't have anything to do. You say, I'm going to take 5 minutes to go upstairs, downstairs, and then in the evening, I'm going to make a brisk walk around the block for 10, 15 minutes. And then when I go to my big shopping mall, I'm going to walk around it. Outside, outdoors, if you can afford that because of weather, or indoors if it's snowing or raining, but you can still do it. And I many times tell people, if you go to one big store, now stores are huge, all you have to do is I walk all the way to the right, all the way to the left, all the way to the left, all the way to the left, all the way, and keep going like for 15, 20 minutes. And I try to do a brisk walking. I take my cart and I do brisk walking. When you take your cart, you have a lot of balance because you're actually using a walker. But nobody is going to notice you have a walker. They think you're a shopper. And when you finish walking around for 15, 20 minutes, what you're going to do is then you do your actual shopping. Then go home and take the garbage out and walk around a little bit, or go upstairs or go downstairs or take the vacuum cleaner. And you're going to see with your cell phone that you have accumulated 30 minutes of activity. Now, there's another very important review that's been published by the Journal of the American Medical Association that says, okay, what's the difference if instead of walking 30 minutes every day, instead of having physical activity for 30 minutes every day, Monday through Friday, what if I do, let's say, an hour and a half Saturday and an hour and a half on Sunday, which is what many people do. You go to the gym because it's your free time, it's your weekend. So many people choose to go to the gym those 2 days and do an hour and a half, something like that. And then after that, you accumulated very well those 150 minutes of activity. Well, the results are very simple. People that do 30 minutes 5 times a week do a lot better than those that cram their exercise in 2 days. So the idea is not like doing a lot, is doing it in a continuous, periodic, systematic way. So it is a lot better if you do your house cleaning every day than if you go to the gym on the weekends. When I talk to my patients, I many times tell them, I want you to do exercise, but don't run for sneakers. I want to do something simple every day. And once again, you can use your phone and get one of those apps that tell you about physical activity, and you can see how much activity you did, how much exercise, and for how long. If you start conscientiously following that, you're making yourself a big service. Once again, 30% overall mortality, 23% heart and vascular disease, and 12% cancer under the regular values. Why? Because you're catching up with what your body needs. You're detoxifying. You're sending blood to every tissue. You're sending nutrition to every part of your body. And the heat you're producing is going to allow you to shed pounds. It's going to allow you to send diabetes somewhere else, etc. Why? Because also there is something very, very important to tell you. When we move our muscles, the muscles have an insulin-like activity. What does that mean? That means that when we are moving the muscles, we are managing sugar very well without help of insulin. So we're not pushing our pancreas. Actually, it's the opposite. We are putting our pancreas to rest because our muscles are doing the job of controlling sugar levels. And you know it. If you go swimming, if you go running, if you go walking, one of the first things you're going to feel afterwards is you're going to feel hunger. Why? Because you consume a lot of sugar. And in no time, you're going to start shedding pounds. And people are going to wonder, what are you doing? And people are going to ask you, oh my God, did you go? You know, the funny thing, and this is a true story, I have a patient that her doctor didn't believe her until he did a full physical examination and review her to make sure she hadn't done a lipectomy or a liposuction. That's how impressive she did. She lost like 30 pounds in about a year of discipline and self-consciousness of her health. We have still more to talk. Well, we're talking about why physical activity can help you to be healthy, to be resilient, to be able to face disease, to be able to stave off disease in a big way, because you have at least 30% chances of improving your survival rate with physical activity. You have 23% improvement in your chances of having heart and vascular disease, and 12% improvement in the chances of getting cancer by doing something that costs you nothing, not one penny. I'm Dr. Rodrigo Rodriguez, Medical Director of BioCare Hospital, and I really thank you for the privilege of allowing me to get to your homes, to your radios, to your TV sets or computers, to the social media of your choice, and be able to convey a message that it's a true calling. Try to let you know that there are many things you can do that are going to keep you healthy and prepared for whatever health challenges we face in the future. And I'm telling you right now that one of the biggest problems I find many times, I'm a doctor and many doctors face this type of a problem. When you talk to a patient, you say, well, I want to do this and so, and they say, doctor, I don't have money. Doctor, I don't have insurance. Doctor, I cannot afford that. I have problem getting to ends meet, and I really can't do it. Even when you talk about food, you say, I want you to eat better. I have many patients that jump immediately and say, doctor, I don't have money to buy salmon. Uh, People always associate, and with a lot of good reasons, salmon to good eating. Absolutely, salmon is a jewel. It's a fantastic food. So if you can do it, do it. It's a very good food. But said that, the important thing is that always when you're talking to people, patients talk about the possibility of doing it or not doing it on economical terms. But today we're talking about physical activity. That's something that we do anyway. It's just that we don't do enough. It's just that we have filled our lives with the washer machine, with the dishwasher. We send clothes to be washed and ironed somewhere else. Everything is pressed outside of the house, etc. Even food, we don't prepare food. We open a can or we open a packet and we just put it in the microwave, and we use disposable plates, so we don't even have to not even put them in the dishwasher. So we're constantly looking for ways that are going to save physical activity. And of course, then we sit down for many hours of no activity whatsoever. We sit down in front of the TV, and if we move, it's because we're going to the fridge to get something. And our children are playing with gadgets all day. They don't, they don't jump, they don't run, they don't do anything. So they're indoors all the time. And I have said it in this program before. I mean, when is the last time you saw children really playing, running, leap, jumping, or anything like that? I don't see it anymore. And that is coming with a very important cost. Now, what happens if I already have a disease? What happens if I'm already sick? Let's say I have a heart problem. Let's say I'm diabetic. Let's say I have high blood pressure. Let's say I have cancer. Is that an excuse to say, doctor, I cannot do anything because I'm sick? No, no way. is completely the opposite. Because one of the best ways to heal is to improve two things in the body. One, heat production, and the other one, blood flow. And guess what? That's what physical activity provides you. So now we are seeing that it is an emerging trend to use physical activity programs as part of cancer therapy. Why? Because one of the things you need to beat cancer is a lot of immune activity and enzymatic activity that's going to happen very well if you move and exercise. Even if you're limited, even if you're in bed, there are things you can do. There are many things you can do to improve the energy expenditure, the energy production, and the heat production in your body. Because the more you do it, the better off you're going to be. Because as the heat goes up, your enzymes, which you need to destroy cancer cells, is going to go up. And you need all those enzymes and all those immune factors to go to every single cell of the body. And that's going to happen because you have a higher blood output, because your heart is beating faster because of physical activity. So when you start doing physical activity, then you're helping to beat the cancer. Now, there's something also very important to mention. You probably have found, or you probably have met people who are on cancer therapy and they're doing very well. Everybody is happy with the results. And all of a sudden they notice that the cancer therapy doesn't work anymore. The same happens with antibiotics. Many times you start a treatment with antibiotic, very successful, and after some time, it doesn't work anymore. Like something happened that the body doesn't function very well with that drug anymore. And you know what it is? It is that many medications are blocked by immune markers and by a very important substance that the body produces that's called lactic acid. And lactic acid is one of the byproducts of the microenvironment of cancer tumors. Cancer tumors have two things. One, they have very poor oxygenation. Cancer cells do not survive well when they have a lot of oxygen. That's why oxidative therapies are so important to manage cancer. That is an everyday happening when you are being treated for cancer at BioCare Hospital. We use a lot of oxidative therapies. But we want to beat this problem. How you do it? By increasing the blood flow. How you increase the blood flow? By increasing the heart rate. So you have to do some exercise, even if you're in bed. You can ask the hospital to put a little bar and raise yourself up and down, and get something, for example, your feet, to move your feet, or ask your family and friends to help you move, like taking one of your legs back and forth and moving the blood so it flows, and it flows more and more, because that's going to deliver a lot of oxygen to those cells. And also, as the blood flow improves in the microenvironment of the cancer, you're going to draw all those toxic substances, all that lactic acid, out of the tissue. And when you take it out, it is going to be disposed by the liver, by the kidneys, by a lot of things. That is what we do at BioCare. We want to improve all these functions because we know they can help us to treat the cancer in a very natural way. And even if you're under any other form of therapy, you need that to help. You need that to enhance. That's why we call it integrative therapies. Because you have to take from here, from here, from here, and see what works and put it together. Because I don't want to prove this or that. I want you to get better. And I'm going to do whatever I have to do to get you better. Because I don't have any problem with using this or this method. If these two work together for your case, I'm going to use them. So that's what we do. And that's why it's important that if you're suffering from any of these diseases, give us a call. Let us know. It's going to cost you nothing. There is no compromise whatsoever. It's just a conversation. But hopefully you're going to have guidance and understanding of where you are and where you could be if you do all your work together very well. So physical activity is now part of any smart cancer protocol because you need it. You need it to make the drugs work well. Radiotherapy works better. Everything works better when we move. So keep this in mind. And you can call. I want you to call. I want you to ask questions. I want you to go to Facebook or to the website. We have a lot of information. I want you to search Truth Be Told Radio Network and listen to other programs that are related to cancer. Cancer is a very difficult, complex disease to deal with, but we have many answers. And many of them are so simple and so easy to do that you can actually start doing it now, right now, at home, as you listen to this broadcast. So ask a question. Be in touch because we can make a lot of difference. And all you have to do, once again, is make a plan. And that plan is, to begin with, physical activity is going to cost you nothing. And the other important cornerstone is going to be nutrition. And food, you have to buy anyway. No matter what you do, you have to eat. So those two things are very simple, but very basic for your healing. Next program, let's keep exploring questions and hopefully giving you answers.